12 million people. According to a study included in a 2008 clinical practice guideline for cerumen impaction, that is the estimated number of people in the United States who seek medical care for cerumen complications. Good afternoon, everyone. My name is Sarah Romero. I've been working in the medical field for 8 years, and for the last year I've spent specializing in the ENT, ear, nose, and throat, and audiology section. Over the last month, I've been exclusively treating patients with excessive amounts of cerumen, amounts so large it was impossible to see their eardrums. I would like to talk to you guys today to educate you on the effects cerumen has on your body and how to prevent cerumen impaction. Although cerumen impaction has a negative effect on your well-being, understanding how to maintain a healthy balance of cerumen is essential for good health in your hearing. So what is cerumen? Most of us call it earwax. I recently retrieved an article titled Earwax and Care from the American Academy of Otolaryngology website. It describes cerumen, and I quote, as a self-cleaning agent with protective, lubricating, and antibacterial properties, end quote. It forms on the outer one-third of your ear canal and is made up of sebum, wax, and dead skin cells. Cerumen acts as a barrier between your outer and middle ear. It protects your middle ear from foreign bodies and bacteria and infections. So that sticky brown substance, which most of us find yucky, is actually good for your health and plays a part in your immune system. Now that you have a better idea what cerumen is and what it does, let's talk about how it affects your hearing. At times, a large amount of cerumen can accumulate in the ear canal and cause a blockage. Although some people don't notice it, ears may feel full or plugged. This is known as cerumen impaction. In 2003, Drs. Isaacson and Vora of the Hershey Medical Center wrote an article for the American Academy of Family Physicians titled Differential Diagnosis and Treatment of Hearing Loss. In this article, they refer to cerumen impaction as one of the leading causes of conducting hearing loss. In fact, in my experience, after cleaning someone with severe cerumen impaction, they often tell me they can hear a lot better now. Hearing loss is not the only cerumen-related complication. Because cerumen works as an antibacterial and lubricating substance, not having the right balance of cerumen can cause problems as well. When a person has a large amount of cerumen stuck in their ears, the cerumen traps the bacteria in there with it. The bacteria now has the potential to cause infections, which can lead to fevers. At the same time, not having enough cerumen in your ears will make you more susceptible to infections. This is because your ears are missing their natural antibacterial property. Other side effects from having too much or too little cerumen include earaches, ear pain, itching of the ear canal, and even coughing fits. With all these risks, it's important for us to understand that the right amount of cerumen is beneficial for our health and safety. With this new information, you may be thinking, how am I supposed to keep the right balance? Well, your body is already doing that for you. Generally, your ears naturally cleanse themselves. The chewing and swallowing motion of your jaw helps migrate the cerumen to the outer ear canal. During this migration, the cerumen dries up, flakes, and eventually falls out of your ear. This is a constant process, so as more cerumen is moved out of your ear, more cerumen is produced. Ideally, this should be the only ear cleaning remedy needed. Another safe way to keep your ears clean is with body temperature water inside of the shower. In more serious cases, your ears may need to be manually cleaned by an otolaryngologist, also known as an ENT doctor. At no time should you ever use Q-tips inside of your ear. Cotton swabs generally push the earwax to the back of your ear and can cause more severe problems. In a selection titled Earwax for the Salem Press Encyclopedia of Science from 2013, Vicki Miskowski explains cotton swabs can lead to more serious problems such as an eardrum perforation. The majority of patients I treated for cerumen impaction proudly admitted they used some brand of cotton swabs. However, if you look on the box of a Q-tip, of the brand Q-tips, it even tells consumers not to use inside the ear canal. About a month ago, I removed a tip from a cotton swab out of a patient's ear who was trying to clean his ears with it. I've just provided you with information on the negative and positive impacts cerumen can play on your health and your hearing. So in conclusion, now that you are aware of why you need a neutral balance of cerumen, it should be much easier for you to create and sustain this balance. Are there any questions about the topics I covered today? Alright, great. Your hearing, like your health, is vital to your survival, and it is important that we protect both.